I'm Carol Celine, talking with otolaryngologist Dr. David Rosen. Within your specialty, you do primarily surgery on thyroid and parathyroid problems. What would those problems be?
In general, the reason for at least thyroid that you'll take a thyroid gland out is either because of size and big goiters that are causing compression and shortness of breath and swallowing problems, as well as nodules that are suspicious for cancer. With parathyroid glands, it's generally done for increased calcium levels and increased parathyroid hormone levels, and in general, that's a single gland that's gone to become overactive.
And you just take it out?
You just take it out, and then they're back to normal.
Do they control afterwards with medication, or is that not necessary?
With the parathyroids, there are 4 glands, so when you take out the one overactive gland, the other 3 usually work normally.
Now, you told me that you have pictures of patients that you've operated on where you can barely even see their scar. That's because of a particular procedure that you do.
That's basically from the minimally invasive surgical techniques I learned while I was in Italy, as well as many other places and courses that I'd taken. But the incision becomes smaller and smaller so that you can have a better cosmetic result, as well as increased or less invasive surgery, so people go home the same day oftentimes.
And that's it? They're done?
And they're done.
Wow, that's amazing. Now, I was very interested in the fact that you do 5 or 6 tonsillectomies a week. I didn't know people were still doing tonsillectomies. First they were doing them, then they weren't doing. So are they back in favor?
They're pretty much in favor when there's a good indication. And I think what happened is, like you said, initially everyone got their tonsils out, then no one got their tonsils out. And now if you meet the criteria, then the tonsils come out, either chronic infection or obstructive size being too large.
And what you did mention, I know my grandson had his tonsils out because he was snoring.
That's one of the obstructive problems when the tonsils and adenoids, especially the adenoids, get large.
Now, that used to be a pretty unpleasant procedure. There was a lot of bleeding involved, and we always worried that there would be bleeding involved. But you're doing it a different way today, aren't you?
There is something that's become more popular over the past several years, which is called intracapsular partial tonsillectomy. And recently we started using a device that actually melts the tonsils, and they just kind of melt away to the point where you're left with, very little tonsil tissue. That's
remarkable. So is it less painful? Is the bleeding less?
The pain is extremely less. It's extremely less painful. They really only need about 1 day of narcotic pain medicine, and after that they usually can move off to something that's not narcotic, and the rate of bleeding is about 1/3 of traditional tonsillectomy.
And you do this for adults as well as kids?
More predominantly children, but some adults, if they're good candidates by having large enough tonsils, and there's always a little risk of regrowth. But in general, if you meet the criteria, we can do this for adults as well.
Well, you told me that many of your kids go home and have chicken nuggets in the car.
I've had a few that have had chicken nuggets, pretzels, popcorn, which you would never even consider that. With traditional tonsils.
In fact, the big inducement was, oh, honey, you'll get all the ice cream you want, so no more ice cream. I'm not sure if that's good or bad. But thanks for coming in.
Great. Thanks for having me.